Welcome to today's video where we're discussing the 10 silent stroke signs you should never ignore. You might think that a stroke always comes with clear, alarming symptoms, but that's not always the case. A stroke, also known as a cerebrovascular accident, CVA, is a leading cause of death in the United States, affecting over 795,000 people each year. Most strokes, around 87%, are ischemic, meaning they occur due to a blockage in an artery that stops blood from reaching the brain. The moment this blockage happens, immediate medical intervention is crucial because delays can lead to permanent brain damage or even death. We often hear about the classic symptoms of a stroke, which are usually easy to recognize. These symptoms include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, trouble speaking or understanding speech, confusion, difficulty seeing in one or both eyes, difficulty walking, dizziness, loss of balance or coordination, and a severe headache with no known cause. While these symptoms are vital to recognize, there are also subtle, lesser-known signs of a stroke that can easily be overlooked. These are often referred to as silent strokes, and they can be just as dangerous as strokes with more apparent symptoms. Silent strokes, as the name implies, don't always show the classic signs we're accustomed to. In fact, many people experience silent strokes without even realizing it. Studies suggest that silent strokes might account for the majority of stroke cases in the United States. These strokes often go unnoticed, which is concerning because untreated strokes are a leading cause of dementia and other cognitive impairments. Understanding the signs of a silent stroke is critical, so let's discuss 10 symptoms you should never ignore. 1. Sudden drowsiness. Drowsiness is a common experience, often associated with lack of sleep or physical fatigue. However, drowsiness related to a stroke is different. It comes on suddenly and without any obvious cause. This drowsiness might be so severe that the person has trouble staying awake, even during conversations. If you or someone you know experiences sudden, unexplained drowsiness that doesn't go away, it's essential to seek medical help immediately. 2. Vomiting and nausea. Vomiting and nausea are symptoms that can be caused by various conditions, but when they occur alongside dizziness or vertigo, they could indicate a stroke. What distinguishes stroke-related nausea from that caused by other illnesses is the absence of stomach pain or diarrhea. If vomiting and nausea appear suddenly without any apparent reason, especially if accompanied by other symptoms on this list, it's important to consider a stroke as a potential cause. 3. Seizures. Seizures are not commonly associated with strokes, which is why they can be an overlooked symptom. However, some strokes present as seizures, particularly in individuals without a history of epilepsy. If someone suddenly experiences a seizure, especially without a prior history of such events, it's crucial to get them to a hospital as quickly as possible to rule out a stroke. 4. Hiccups. Hiccups might seem harmless, but persistent or prolonged hiccups can be a sign of a stroke, especially in women. Stroke-related hiccups are usually not the kind that go away after a few minutes. Instead, they can last for hours or even days. If prolonged hiccups are accompanied by other stroke symptoms, such as numbness or weakness, it's essential to seek immediate medical attention. 5. Pain. Pain is another symptom that might be linked to a stroke, though it's not as commonly recognized. Stroke-related pain can occur in the face, arm, or leg, or it might be more generalized. It often presents as a sudden, sharp pain or as a burning sensation. Sometimes, this pain is accompanied by other symptoms like numbness or weakness in the affected area. A headache, particularly one that comes on suddenly and feels different from a typical headache, can also be a sign of a stroke. 6. Fainting. Fainting, or losing consciousness, is often dismissed as a sign of dehydration or exhaustion. However, it can also be a symptom of a stroke. Fainting due to a stroke may occur when the blood flow to the brain is significantly reduced. If fainting occurs suddenly and without a clear cause, particularly in someone who is at risk for stroke, it's important to seek medical attention immediately. 7. Memory lapses. Memory problems are a common symptom of a silent stroke. These memory lapses might involve forgetting parts of your day or even experiencing difficulty remembering where you are or how you got there. More concerning is the sudden inability to form new memories. If you or someone you know experiences these kinds of memory problems, it's important to consult a healthcare professional to determine if a stroke could be the cause. 8. Dizziness. Dizziness is a symptom that can be caused by many different conditions, but it's also a common sign of a stroke. Stroke-related dizziness often comes on suddenly and might be accompanied by a feeling of vertigo or the sensation that the room is spinning. If dizziness occurs suddenly and without an obvious cause, especially if it's severe enough to cause balance problems or fainting, it's important to seek medical attention immediately. 9. Disorientation. Disorientation, or difficulty understanding where you are or what's happening around you, can also be a sign of a stroke. This disorientation might involve confusion about time, place, or identity. For example, you might not recognize familiar surroundings or people. Disorientation can also lead to short-term memory loss, where you suddenly forget recent events or conversations. If you notice this kind of confusion, it's crucial to seek help right away. 10. Neuropsychiatric manifestations. In some cases, strokes can present with neuropsychiatric symptoms, such as sudden changes in mood, behavior, or cognitive function. These changes might include sudden depression, anxiety, or even psychotic episodes. Such symptoms might be the only sign of a stroke, making them particularly easy to miss. If someone suddenly exhibits these kinds of symptoms without any prior history of mental health issues, it's important to consider the possibility of a stroke. Causes and treatment of strokes. Understanding the causes and treatments of strokes is essential for prevention and recovery. High blood pressure is one of the most significant risk factors, increasing the likelihood of stroke by 2 to 4 times. Heart conditions, especially arrhythmias like atrial fibrillation, also play a major role, increasing stroke risk up to 6 times. Other causes include smoking, diabetes, high cholesterol, obesity, and a sedentary lifestyle. Treatment for a stroke depends on the type, severity, and timing. The primary goal is to restore blood flow to the brain as quickly as possible to minimize damage. For ischemic strokes, treatment might include clot-busting drugs like TPA, which must be administered within a few hours of the stroke's onset. In some cases, surgery might be necessary to remove a blockage. For hemorrhagic strokes, which involve bleeding in the brain, treatment might focus on controlling the bleeding and reducing pressure on the brain. Preventing strokes involves managing risk factors like high blood pressure, high cholesterol, and diabetes. Lifestyle changes, such as quitting smoking, eating a healthy diet, exercising regularly, and maintaining a healthy weight, can significantly reduce your risk of stroke. In conclusion, silent strokes can be just as dangerous as those with more obvious symptoms, but they're often harder to detect. By being aware of these 10 silent signs, you can better protect yourself and your loved ones. If you experience any of these symptoms, don't wait, seek medical help immediately. Thank you for watching, and don't forget to like this video, share it with your loved ones, and subscribe to our channel for more health tips. Stay safe, and see you in the next video.